Hello, I am Dr. Mirela Cernăianu, and I welcome you to the Wellness Optimizing Warrior MD podcast, the WOW MD podcast. I am not your typical wellness coach, and this is not a typical wellness podcast. Here, I'll discuss educational facts about health, hormones, intimacy, anti-aging, and beauty trends, all very hot topics, to empower you to make great choices when it comes to your health and to your body. I want you to go, wow, I did not know that. Or, wow, this is going to make a great difference for me. Our healthcare system is broken and it needs a revolution. You and I can start one today. I am willing to share my knowledge with the world if you're willing to listen. Let's get started. Hello, listener, and welcome to the episode about navigating functional testing for thyroid health, the thyroid tests that do matter and add value. Which ones should you focus on? I would like to continue where I left off last week and discuss thyroid optimal testing. Last week, I spoke a lot about TSH, thyroid stimulating hormone, and why it is a bad thyroid test. So I'm not going to revisit that again, but what I'd like to talk today is what is the best thyroid test? So let's continue the discussion about thyroid hormones. As I mentioned before multiple times in the previous podcast episodes about thyroid, T3 is the only active thyroid hormone produced by the thyroid gland. It is also called triiodothyronine. Our T3 comes from T4, the inactive form of thyroid hormone, called thyroxine, through the process of deiodination. So again, the T4 is the inactive hormone. The deiodinase enzyme comes and removes an iodine molecule from the T4. Now we have T3, the active hormone. So removing an iodine molecule from the T4 yields a T3 hormone, and that's done through the process of deiodination, the removal of the iodine molecule. Again, remember the T3 hormone is the only active thyroid hormone, as the body has to convert it T4 to T3 effectively in a natural way. Otherwise, doing any kind of T4 therapy will be useless. We'll revisit this again in another podcast episode. But a little bit more right now so we can understand what are the best tests for thyroid. Let's talk about this T4, T3 balance and why one is inactive and the other one is active and which one should we test for. Well, they're kind of both important. And let's talk about this and explain why. Let's use the analogy with a bank account balance. You most likely have a checking account, and hopefully you also have a savings account. I'm going to use this analogy so you can understand the difference between T4 and T3. You pay all your bills and you do every day-to-day transaction off of your checking account. Your savings account balance is really important. It's a reserve. You want to fall back on it and withdraw money from it when you need it. That's why it's savings. But you're not running your day-to-day transactions from your savings account. Again, this is an account where you keep the money for when reserves are needed. So let me apply this analogy to the thyroid hormones. Please imagine the T3 hormone, your active thyroid hormone, is your checking account. And your T4 hormone is your savings account. Now, the money from your savings account has to go to your checking account in order to be used for day-to-day transactions. Imagine you're sitting on a huge pile of money, but it's all in a trust fund, where the bank limits your transaction, because it's a savings account, to maximum 5 a month. And you cannot withdraw any money from it, or you're very restricted, and allow these 5 transactions, each one of them with a $500 limit. Well, obviously, if you have a depleted checking account, and you're limited in how much money you can transfer from your savings to checking, you will not be able to lead a normal life. You will not be able to pay your bills. your rent, pay for food, etc. Let's take this analogy and apply it to our thyroid hormones. The T4 is your savings account. It's a reserve thyroid hormone. The T3 is your checking account, is your active hormone. The hormone does things in your body that interacts with the cells. So having a large amount of circulating total and free T4 and a low amount of total or free T3 hormone level is the same as your money being tied up in a trust. Because if your body does not convert your T4 to T3, then your body's ability to have an optimal functioning thyroid is significantly affected and significantly impaired. So let's come back to thyroid testing discussion. If you look at your bank account, you want to know what your checking account balance looks like, but also you want to know your savings account balance. Hopefully, you don't have to go back and forth between savings and checking a lot. So hopefully your savings account, it's something that's there at the back of your mind. But your checking account balance might change rapidly from day to day, month to month. So obviously checking both T4 and T3 levels is key in properly evaluating thyroid function. You need to know what both look like. Now, let's talk about total hormone levels versus free hormone levels. The total hormone level, whether it's T4 or T3, really reflects a pool of circulating hormone that is bound by a carrier protein. So this is not just for thyroid, this is for every other hormone in the body that circulates in the body through the blood. They all have to be bound and carried by these protein carriers. Those are called thyroid binding globulin, sex hormone binding globulin, etc. So the thyroid binding globulin is a carrier protein that is very important. And this protein needs to be produced and be available in normal amounts in order to be able to circulate all the thyroid hormones that the thyroid gland is producing. Imagine the thyroid can produce lots of hormones, but there are no available seats on the bus to transport them to the rest of the body. This is not a good situation. That is rare, and usually the thyroid binding globulin, it's not necessarily deficient. However, what is required to move the thyroid around, it's also controlled by the TSH. So when we need more thyroid binding globulin, the body will actually increase the TSH. I'm getting too deep into the weeds here with too much detail that you don't need to remember. Just remember, hormone circulates in your blood to be carried to the cells in a bound form. That is your total hormone level. So a big problem we run into is when the carrier-bound thyroid hormone level looks great, but the free circulating hormone level is low. To use another analogy, it means that the bus, which is the carrier protein, is full of thyroid soldiers. The soldiers need to go to the cells and do things. But these soldiers cannot get off the bus to do anything inside the cells. It's like the carrier bus keeps going around and around and around and does not stop to let the thyroid hormones off the bus to do their job. So obviously, knowing what your free thyroid hormone levels are is very important, because just checking the total T4 level or the total T3 level gives us an incomplete, again, very skewed view of what is actually happening at cellular level in the many organs that depend on an optimal free and active thyroid hormone level. If you suffer from chronic fatigue, if you have widespread inflammation in your body, if you have achy, stiff joints, foggy brain, a variety of other symptoms, or you have elevated markers of inflammation in your body, if you suffer from any acute illness that's prolonged over 10 days, if you suffer from chronic digestive issues categorized as IBS, chronic constipation, colitis, Crohn's disease, ulcerative colitis, SIBO, heartburn, etc., you likely have a degree of thyroid dysfunction as well. The problem with these situations is that the inactivating type of deiodinase is present in a very high proportion in our bodies, and the conversion of T4 to T3 is significantly reduced. That is impairing our body's ability to effectively manage and maintain an optimal and healthy thyroid function. I discussed this in more detail in the previous episode, but I wanted to mention it again because it's very important. Again, why this enzyme is very important and their proportion and their specific activity is because the only active thyroid hormone capable of cellular function, of cellular effects in the target cells, is the T3 hormone, not T4. T4, again, has to be converted by one of these enzymes in the active form. There's a serious refusal of many endocrinologists and practicing primary care physicians to check T3 levels. The only explanation for this is most likely the lack of training and the lack of understanding. Knowing and understanding that your T4 has to be converted into its T3 form in order for the cellular action to happen, and refusing to acknowledge that there is a great majority of people who do not normally or optimally convert T4 to T3 due to all the factors I mentioned above, in my opinion, is practicing poor quality medicine. Again, it's possible that the only explanation is that these doctors don't know, they're not aware, they haven't been trained, they haven't been presented with the correct facts, with the correct information, and they keep practicing the same way because it is easy and it works well for some, and they're not really concerned as to the why it doesn't work well for all the patients. What's unfortunate is that these specialists, endocrinology specialists, and primary care doctors will continue with T4 only treatment, even though some of their patients don't feel well. They most likely justify it with, it must be something else. Maybe it's the sex hormones, maybe it's the mood, maybe there's autoimmune issues, because the labs look good. So I can't be wrong. It cannot be the thyroid medication. You, the patient, needs to understand that when you take or you are prescribed only T4 therapy, which is Synthroid, levothyroxine, Levoxil, Thyroxine, etc., and your doctor is purely looking at TSH or maybe TSH and total or free T4 levels, then please understand that your doctor is not looking at all the right tests and you are possibly not getting the right treatment. It is absolutely crucial that you are educated enough and you understand these simple facts and the information presented here in order for you to take control of your health, especially when it comes to your thyroid management or lack thereof. Let's come back to T4 and T3 levels. Should we check total T4, total T3? Should we check free T4 and free T3? Should we check both? Well, ideally, we would check both. Keep in mind, only the free circulating hormones are able to effect cellular action. The total circulating level is almost meaningless if the amount that is circulating freely is insufficient and too low to work and circulate throughout the body and provide optimal cellular function. Again, let me use the analogy I used before. The hormones that are not free, that are bound and transported into the blood, they're circulated around, bound to this transport protein. They are not able to provide any cellular action. They will not attach to the cellular receptors and they will not enter the cells. It's similar to having a whole army of soldiers ready to do the work, but they have to be carried around on buses and they need to get off at the bus stop in order to do their job, except the buses keep going around and around and around without stopping at the bus stop. That is what happens when the thyroid hormones that are not freely circulating within the body, the bound total thyroid hormones, are too high. and we don't have enough circulating boots on the ground, soldiers or workers, call it what you will, to do the job. This is very, very important. Most of the patients that bring me labs from various doctors that I've seen in the past, and when I review them, and when I say most of the patients, I mean about 90% or more, they have labs that only look at TSH, maybe total T4, maybe free T4 and total T4. Sometimes I see total T3. Less than 10% of patients that are coming to me for thyroid management actually bring in labs that look at all the important hormone levels. TSH, total T4, free T4, total T3, free T3, reverse T3, and thyroid antibodies. In a nutshell, these are your tests that you need to have ordered for thyroid. Let's talk a little about what is the normal level for the free T3 and a free T4. Let's start with the T3. This is our active hormone. That's the one that matters. Well, the lab range for free T3 for Quest is usually minimum 2.2 and the maximum is 4.2. Think about this for a second. If you consider 2.2 as 1 percentile and the maximum level at 4.2, 100 percentile, how do you think you will feel if your free T3 is 2.5? Would you feel good? Likely not. Energy, weight management, heart rate, mood, everything depends on thyroid. So if your thyroid is your gauge energy indicator, how do you think you will feel and how well would your body work if your energy gauge indicator is at 15%? You wouldn't feel good. Likely you will feel poorly, and you will feel more poorly the closer to the lower bottom number of the normal range you are. Again, let's use this analogy so it's easy to understand. Think of your thyroid free T3 level as a gauge indicator for your energy fuel tank. When you're close to the higher range of normal, your tank is full. You're good to go. Your body's functioning well. If it's over, it's too well, that's another problem you need to look into. When, however, it's closer to the bottom range of the normal number, then your tank is almost empty. This is simple enough, right? It makes sense, and it should be the common sense way to interpret the thyroid level numbers this way. However, doctors refuse to understand that the lower range, anything that's between 2.2 and 2.9, could indicate thyroid dysfunction. And they keep telling patients that their thyroid is normal because it is in range, when in reality, it's not. Let's do the math for this. If you mathematically add 2.2, the lower number, to 4.2, the top number, you get 6.4. If you divide 6.4 by half, you get 3.2. That is an average median 50 percentile range for what should be optimal thyroid function. It's not really optimal. Optimal should be 50 to 80 percentile. We physicians are not computers. There is an art to practicing medicine. And unfortunately, it seems to me that in today's modern world, a lot of physicians rely simply on labs and imaging tests to make a diagnosis. So the evaluation of a client, a patient that's sitting in front of you, by listening to their clinical complaints and looking for clinical signs with the physical exam, has pretty much gone out the window. That could be the only explanation for why a patient will present to a doctor complaining of fatigue, weight gain, depression, constipation, dry skin, headaches, foggy brain, irregular periods, infertility, so on and so forth, would undergo testing for the thyroid and then be told that the thyroid is normal when the patient has all these symptoms, or some of them, but the level is beneath 40 percentile. In my mind, it's like going to the gas station to buy gas for your car because you're driving Los Angeles to Vegas, You want to fill up your tank, but then the gas attendant only fills it up halfway, tells you, oh no, you're fine. You're 30-40% full tank of gas. You can make it all the way from LA to Vegas and back. Well, we know that's not true. So it's absolutely mind-boggling to me how common sense has gone out the window when doctors look and interpret thyroid function tests. And trust me, this applies for other tests as well. This is the reason why anti-aging medicine caught my attention and resonated with me, because it is easy, it's common sense, and focuses on optimal levels and correlating it with clinical signs and symptoms. An anti-aging functional medicine consult, it's not a 5 to 10 minute appointment to look at labs and adjust medication based on labs. You also need a detailed interview of what is going on clinically with the patient. Medicine is still an art, and choosing a provider that is a wealth of knowledge that will sit down with you, educate, talk to you, explain to you the testing, explain to you the medication, explain to you your symptoms, versus going to a 5 to 10 minute doctor. Yes, choosing such a provider might be more costly, but so much better and more rewarding for your health. The point of this podcast is to allow you, the regular person, the patient, to know more than perhaps your doctor knows. I'll be honest with you, and I'll let you know in many circumstances I have had my eyes opened and I learned something new from a patient. I hope your doctor is wise and humble enough to know that he or she does not know it all. And hopefully when you, the patient, start talking facts and optimal numbers and provide information, instead of turning off your doctor or setting him or her on a hissy fit about how you shouldn't browse the internet, hopefully your doctor will listen to you and say, that's interesting. Let me look into it. That's a doctor you should continue working with. The other kind, you should probably ask them to listen to my podcast or give me a call. I'll be happy to talk to them as physician to physician. Took a little detour here. Let's come back to talking about the normal range for T4. The minimum range for T4 is 0.8. The maximum range at Quest is 1.8. Let's do the same thing we did for the T3 levels and add mathematically 0.8 to 1.8. That is 2.6. Divided by half, we come up with 1.3. So how could you possibly think that your T4 level is normal if it is 0.9? That is 10 percentile. This is your main reservoir of active thyroid hormone. So if it's just about 10% of what it should be, then how in the world would your thyroid be well? Well, perhaps your body's functioning purely on the checking account, your T3. And it has enough T3 to just do its daily needs, and it doesn't really need to have high reserves. That's not necessarily a bad sign if your T3 level is optimal and approaching 3.2 to 3.5. Otherwise, if both your T4 level and your T3 levels are low, you need to work on that. That needs to be addressed. Your thyroid is not functioning well. So I'll let you ponder this 10 percentile. Is it normal? Is it not normal? But let's move on. We talked about TSH ad nauseum in my previous episode. We talked about T3, T4 in this episode. The only thing that remains undiscussed is thyroid antibodies. So let's discuss thyroid antibody testing. Hashimoto described and discovered autoimmune thyroiditis at the beginning of the 20th century. We are now in the 21st century, over 100 years later, and the amount of autoimmune thyroid dysfunction is staggering. What I want you, my listener, to know is that autoimmune thyroiditis, it's not a thyroid problem. It is an immune system problem that becomes a thyroid problem because these antibodies target thyroid tissues, attack them, inflame them, replace them with scar tissue, and slowly destroy them over time. What is mind-boggling to me is that so many physicians ignore Hashimoto antibodies. They don't test for them. They don't really know what to do with the results when they get them and it shows positive. They don't know how to advise patients on how to manage them. So they probably just shy away from even ordering this test. Now, the information about thyroid antibodies is out there. All you have to do is a little research. Hence, this podcast. The thyroid immune system dysfunction is well known and well established, and I would like for you to know some facts as well. Let me give you some statistics. 80% of thyroiditis sufferers are women, and 60 to 80% of hypothyroid patients. So if you have a low underactive thyroid and you've been diagnosed with it, there's an 80% chance you have Hashimoto's. We also know that there is a connection between a dysfunctional immune system and a damaged intestinal lining. This is well known and well established. We also know there's a connection between stress and a damaged intestinal barrier. This is also well known and established. So we first have stress, then we have a damaged, hyperpermeable or leaky intestinal barrier. Then we have a dysfunctional immune system that leads to a thyroid attack caused by our own antibodies that create destruction, inflammation, and scarring, replacing normal functional thyroid tissue with fibrotic, non-functional tissue. The exact cause is still unknown, but we need a couple of things to line up. And if you need more information, the autoimmunity podcast, that episodes that I've done in the past will provide that information. So please go back and listen. But in reality, we need genetic susceptibility, environmental triggers, and leaky gut. Those are the three potential contributing factors. Again, leaky gut syndrome, although not fully recognized as a distinct medical condition by all practitioners, is characterized by the damaged lining of the gut wall. This damage results in these minuscule pinprick-style openings, which are the junctions between the cells that are now wide open, through which substances that normally exist in the stool and will be eliminated and flushed out, now they seep from the gut into the bloodstream. These substances include undigested food particles, bacteria, toxins, etc., and they can generate an immune response and create chronic inflammation. The connection between a leaky gut and autoimmune conditions, including thyroiditis, originates from the principle of molecular mimicry. Breaking this down, in simple terms, proteins from foreign substances that have leaked into the bloodstream that resemble the body's own tissues will evoke a response of our immune system, which in its endeavor to combat these foreign substances now start attacking similar-looking proteins in the body, like thyroid proteins, when they get exposed to gluten, instigating autoimmune thyroiditis. Furthermore, what you should know is that the gut harbors about 70% of the body's immune system cells. So an imbalance or disturbance in the gut, including bacterial overgrowth or dysbiosis, can and will interfere with the immune system's functioning. This type of disturbance can potentially increase the risk of developing autoimmune disorders. There is also a noteworthy connection between the gut and the thyroid through the connection of hormones. For example, most of the body's serotonin, a neurotransmitter associated with mood regulation, is produced in the gut. So when the gut lining is compromised, production of serotonin might be affected, leading to mood disorders, and those frequently coexist with thyroid diseases. Let's come back to the thyroid antibodies. I took a little detour to explain how these thyroid antibodies are formed, but please know that there is a test for thyroid peroxidase antibodies for hypothyroidism and thyroid-stimulating immunoglobulin for Graves' disease. And please know that if your doctor or yourself will not address this process, the autoimmune attack on your thyroid, this will slowly and gradually and inexorably lead to a complete and total destruction of your functioning thyroid. The let's just wait and see should not be an acceptable approach if you have Hashimoto thyroiditis. Please try to do something to save your gland. And yes, additional knowledge and additional experience is needed to reverse or stop this onslaught. Simply following a gluten-free diet is not enough. You need to address the gut lining barrier compromise. You need to address what led you to develop a compromised leaky gut barrier. And this is when you want to get a provider on your team that cares about the root cause and actually knows how to and is willing to work with you to address it, to reverse it, and possibly cure it. In conclusion, although further research is required, current studies indicate a potential link between leaky gut syndrome and autoimmune thyroiditis. The key to uncovering more about this connection may lie in a better understanding of gut health, of the gut-thyroid axis, and the role of microbiome balance. Hopefully, this could lead to more advanced and holistic treatment methods for autoimmune thyroid disease in the future, because right now, conventional medicine has none. I will stop here, and I really hope that you were wowed and you learned a lot of useful information about thyroid testing. If you'd like to know more about how your thyroid works, or you'd like to become one of our clients, please visit our website, www.herabeautyandwellness.com, to request an appointment. I say goodbye for now until I see you next week. If you liked the information you heard and you'd like to hear more, please subscribe and follow my podcast. Should you find the content helpful to not just you, but possibly others, please share it and feel free to leave us a review. You are welcome to join the Facebook group, The Warrior Optimizing Wellness MD. I certainly hope that you've heard many things in this podcast that made you go, wow, I did not know that, or wow, I'd like to know more. So keep listening and I'll keep talking.